going under the knife and actually feeling all the pain. In what was supposed to be a routine surgery, a St. Louis man says it was anything but.
I'll say. Now he's filing a lawsuit against Washington University and the people in charge of making sure he didn't feel a thing. Chris Nagus from our sister station in St. Louis reports.
It was like torture, you know?
For Matt Caswell, the memories of his surgery at St. Charles County Hospital remain fresh.
I need to get out of here. I need to get out of here. I need to get out of here. Matt, I need to get out of here.
His mother shot this video in July 2020.
I know, honey.
Caswell says he was scared and in pain after undergoing surgery for a hernia.
And I remember them, strapping me down.
Caswell says the surgery was anything but routine. He was expecting to drift off into unconsciousness under general anesthesia. But Caswell says that didn't happen.
I just remember the mask getting put on my face. I knew I was in trouble when I felt the cold iodine hit my belly and they were scrubbing me off. So like at any second I was waiting to go out, I just all of a sudden got stabbed in my stomach. It was just like rusted razor blades. It was just so bad.
You're saying that's what it felt like?
Yes.
He says there was a towel over his face and he was unable to speak because he had already received an initial paralyzing agent prior to surgery. His attorney, Ken Volstek, explains.
He was paralyzed, couldn't move, couldn't blink his eyes, nothing.
Couldn't speak.
Couldn't speak, can't do anything. Out, just awake, but unable to move. He then was supposed to be given a mask over his face, which was done, and that mask contains what we would probably call knockout gas. It puts you under. And that gas was not turned on by the anesthesiologist. They forgot.
Do you remember feeling the incision being made in your body?
Absolutely. That was at the very beginning. There were three. They came in, one in the belly button and one right here and then one right here.
Caswell is now suing the anesthesiologist, the certified registered nurse anesthetist, and their employer, Washington University. According to the lawsuit, Caswell could feel pain and hear everything that was said in the operating room for at least 13 minutes.
I could hear him talking, Did you get your dog this weekend? My heart rate was just jacked.
And that's something Caswell's attorney notes in this demand letter to Washington University. He says the medical professional should have realized Caswell was awake based on his vital signs.
His heart rate went through the roof. His blood pressure went to what's called hypertensive crisis 3, which is what happens to you right before you have a heart attack. And it continued at that rate for 13 minutes without anyone in the operating room noticing it.
Volstek provided these medical notes to News 4. The anesthesiologist in Caswell's case noted, a review of the anesthetic record demonstrates a delay in initiating inhalational anesthetic after induction of anesthesia.
When it was over, they put in the medical records. We made a mistake. We did not turn the gas on until partway through the procedure. So not only does his physical records, that is the way his heart rate and his blood pressure skyrocketed, prove the case, but they admit it.
The medical record goes on to say, the patient and his mother were immediately informed regarding the delay initiating the inhaled anesthetic agent until after the start of the surgical procedure. And we provided emotional support, along with a recommendation for a psychology consult.
My sleeping has been terrible.
So you're having flashbacks to this?
Absolutely.
How common is this?
Not very common, but it does occur.
Dr. Dan Forrest is a North Carolina anesthesiologist. He's been retained by Caswell's attorney as an expert witness in the case. He says Caswell experienced what's known as intraoperative awareness, and that most cases are due to equipment failure, not the medical professional forgetting to turn on the equipment. So I asked how to prevent it. Is it going too far for the patient to say to the anesthesiologist, hey, make sure you turn the equipment on?
Well, I think what's important is that patients should speak with their anesthesiologist prior to surgery.
Dr. Forrest says it's important for the patient to understand what to expect. During some procedures, patients might hear conversation or be aware of what's happening depending on the level of sedation. But under general anesthesia, Forrest says the goal is to keep the patient unconscious and unable to remember.
It was so scary, I thought I was having a heart attack.
For Caswell, it's a nightmare he wishes he could forget.
I would have actually rather died on that table. And I think that says something.
A lawyer representing Washington University in St. Louis, the doctor, and the CRNA told me via email Washington University's policy is not to comment on pending litigation matters and is also prevented from commenting due to HIPAA protections afforded Mr. Caswell. If you want to see the entire lawsuit, we have a link on our website. Chris Nagus, KCTV 5 News.